And let's definitely talk about blue light, because blue light's
great.
getting all the attention these days. And I've been joking and saying it's kind of like the new gluten. There's an interesting study that just came out that says a year after a head injury, up to a third of adolescents still have symptoms like irritability and headaches that clearly impact performance in school. Screen time is the new pandemic. And we now have data to support how this is impacting for kids, social development, emotional development, cognitive development, but of course now visual development.
Hey everyone, and welcome back to another episode of Wellness for Life. I'm your host, Niki Wolf. And if you are listening today and if you've ever struggled with vision, whether it's from reading difficulties, post-concussion symptoms, or simply feeling like your eyesight doesn't match up to your potential, this is the episode for you. We are going to be diving deep into the world of vision and how it impacts everything from our learning to recovery and even our performance in daily life. I am so excited to be joined by Dr. Appelbaum, a pioneer in neuro-optometry who has helped countless individuals unlock their full potential through vision therapy. And his expertise includes reorganizing visual brain post-concussion to help people not only return to learn, but return to life. He's also works with others facing visual development delays that can interfere with reading and learning, as well as enhancing visual skills for athletes looking to improve performance. So if you've ever wondered whether there's more to vision than just how well you see, you are in for an eye-opening conversation. Dr. Appelbaum, thank you so much for being here.
It is such a pleasure to be here. Thank you for that intro. And this is going to be fun today because everyone's going to learn so much about what they had no idea they didn't know about, and really why everything you know about vision is wrong up until this point.
Absolutely. I think vision is really only on our radar if we're wearing glasses, we already have impairment. Maybe our parents have some vision issues, but I think there's so much more beyond that I don't even know. So I'm excited to dive into this. But before we get into the details of vision therapy, I'd love to hear more about your journey. What led you here? How did you even get into this field?
Yeah, so there's an hour-long version or a couple-minute version. I'll give you the couple-minute version, but I'm really a product of the work that I do. And growing up, I had terrible visual developmental delays. I had poor depth perception. My eyes didn't work well together as a team. I had trouble focusing my eyes, and how that showed up in life. I was lost on the soccer field. I was in the classroom having to pretend to walk up to the board to sharpen my pencil because I couldn't see what the teacher was writing. I had such a poor sense of self and space, and my interpersonal communication skills were trash because I hadn't developed the ability yet for my eyes to work together as a team. So I attribute all of my success in life, athletically, academically, interpersonally, to what was facilitated or created for me with vision therapy. And we'll talk about what's involved with that. But I mean, it took a disability and turned it into a strength for me, where I really learned how to rely on vision to give myself an advantage in the world. And, what was accomplished for me in a very long time, we can now accomplish for people in a matter of weeks or months, depending on the situation. And so I've just been so dedicated to evolving vision therapy in terms of technological applications, innovations, practices, protocols to really get vision therapy to where it is today and to where it's going to evolve to and what it's going to become as awareness continues to be raised.
That's incredible. There's one thing you mentioned that I want to just pull out and focus on. Something that I firmly believe, and I'm hearing you're saying it, is I took my disability and turned it into a strength. And I think that's so important, whether we talked before this call, no matter your diagnosis, your circumstance, how do we take what we're going through and leverage that to make it a strength? And that's clearly something you've done. And the direction and path of the work that you're doing is only helping more and more people. I'm curious, did you do, we'll talk about vision therapy, but I'm guessing your childhood was filled with a variety of this type of different modalities in therapy?
Yeah, well, I love what you're saying about diagnosis. I tell all my patients a diagnosis is a temporary endpoint. And with the right work, right motivation, with the right compliance, it does not have to define you. And you can shed any diagnosis and, really unlock so much of life's potential. My childhood, I did a ton of office-based vision therapy. I did sensory integration-based occupational therapy. And I really learned how to use my body and my eyes as a team. And even when we think about vision in general and visual skills and abilities, every child is born without the ability to track their eyes, converge their eyes, focus their eyes. Everyone's born with no depth perception. It comes through our life experiences and learning how the world appears from other perspectives and learning how to build off of the developmental milestones and the motor foundation to then be that kind of pillar that we stand on to develop the ability to use our eyes together as a team. And so these skills are either learned well or not learned as well as they could be. And that's when some intervention is needed. But these functional vision problems, they're everywhere and they're often hidden until you know what to look for. And then when you know what to look for, they're literally right in front of your face. So I hope all the listeners today, if you can hang on through this entire podcast, you're going to know exactly what to look for so that you can identify unnecessary struggling because of these hidden functional vision problems that healthcare doesn't really even know what to do with, know how to identify, and for sure don't know how to treat yet because we're, at least in the eye care world, so focused on intervention of disease and structure rather than function and really being proactive rather than the reactive model that we're all trained under.
Absolutely. I think hopefully there's a push now, more of this preventative. I mean, we were talking about this, health conference that just went on. I think bringing up the conversation of how can we start integrating some of these holistic modalities and therapies prior to disease or issues coming up, especially now we have all the science to be able to look at genetics and your precursors of what you might be predisposed for. And so I think that's so incredible. One thing that I think will start us off as kind of solidifying this foundation of what is the difference between eyesight and vision, and why is it so important for people to understand this distinction?
All right, Niki, thank you for bringing this up from the start. So if there's one take home from today, it's that eyesight and vision are separate entities. There's also going to be 100 take homes, but this is a big one. So healthcare really has it all wrong about the eyes. I mean, we're all taught in school to be on this heavy pursuit to see the 20/20 line, to see the smallest letters on the chart. But eyesight and vision are completely separate entities. Eyesight is our ability to see. That's letters on a chart. That's a street sign. That's for a child to see what the teacher writes on the board in the classroom. That's what we have glasses for. And eyesight really is just a symptom. Vision is far more complex. Vision is how our eyes move together and focus and converge and track and process information, and how we derive meaning from the world around us and then direct the appropriate action. So eyesight is glasses, vision is brain, and vision problems are brain problems. And there's a fix for the vast majority of these brain problems with something called vision therapy, which is a treatment designed to rewire the software of the brain to change how somebody takes in the world around them and processes visual information.
That's incredible. So and I know we'll dive into it, but from just that little piece, if you have eyesight problems, and we generally, maybe the old mechanism is here's some glasses or here's some contacts, you're saying that there's potential that we fix the underlying vision issues, and that could be, then the glasses can go away.
So take somebody whose glasses change every year, especially for adults. That's not normal. The visual system is not still developing. But so often, if we're looking at the symptom, which is blurry vision, then the option or the Band-Aid approach is here's a pair of glasses that takes what's blurry and makes it clear. And then so often that becomes your normal. You adapt to that, and then you need something stronger to maintain that same clarity. But if we look at the root cause, or why far away is blurry, often it has to do with a near problem. So maybe it's the focusing system, the inside muscles of the eyes responsible for clarity. Maybe they have difficulty sustaining focus or maintaining flexibility, or maybe it's the eye coordination system, the outside muscles of the eyes. But if we address the root cause, then the symptom of distance blur no longer is an option. So what's crazy is when you get a new pair of glasses from an eye doctor and you put them on and it's like, oh, this doesn't seem right. It doesn't feel right. And you're like, oh no, just wear them. You'll get used to them. You will get used to them, but that's a problem. That means they're not the right glasses at the right time. And I'm a big believer that if we're prescribing glasses and really prescribing anything in life, but specifically for this conversation, it should be the weakest lens possible that gives the most improvement, but it should improve performance and it should be balanced between each eye. So I always talk to my patients about achieving 20 happy rather than 20/20. We don't have to see HD clear. Not everybody sees the same way. So we don't need to make everybody see the same way. And so many vision problems out there are almost created with this reactive model and by just addressing the symptoms, but completely ignoring the root cause.
And I feel like in the health industry, we've laid out this concept of acute. I mean, if we're talking diseases, acute and chronic, and I'm kind of hearing that it has the vision and eyesight has somewhat of that lens where you take diabetes, for instance, and the symptoms of the acute reaction that's created. Let's not put a Band-Aid on the acute issues. Let's heal the underlying chronic issues. So I'm hearing, let's, get away from the symptoms. Let's figure out at the root issue of what's going on. And that might change. I don't know if you're familiar with Dr. Dale Bredesen. He's a top neurologist. He actually formulates one of our brands, NeuroQ. And one thing he talks about, and I might mix it up, but he talks about a lot of times we're putting a Band-Aid on what's creating Alzheimer's and dementia. And he's talking about these amyloid plaques. And we really need to get to why are these happening in the first place? And let's fix that so we don't keep putting a Band-Aid on top of it. And so I guess I always like to use like analogies and metaphors to make like solidify that understanding in my brain. But it sounds like let's stop putting a Band-Aid on some of these other issues. Let's pull back, look at the root of what's going on, because we do that with so many other things. But why haven't I heard about it with vision health?
Well, we all think that as we get older, there's cognitive decline and there's visual decline. And that's true. That often does happen. It doesn't have to happen. If you get ahead of it, if you're proactive, you can make it so that you optimize brain function and you enhance your visual system so that you're not needing to rely on outside help to achieve the same response. What you bring up about diabetes, that's from often 10, 20, 30 years of poor decisions that then just builds up, right? The equivalent of that now and of the diet that causes diabetes or the lifestyle choices that causes diabetes from a visual perspective is screen time. And what we're all doing right now, you're exactly right. I mean, screen time is the new pandemic. And we now have data to support how this is impacting for kids, social development, emotional development, cognitive development, but of course now visual development. And we could go down a long rabbit hole here on how myopia or nearsightedness is increasing at an incredibly alarming rate because of a lot of reasons, but one of the three main reasons is excessive screen time. And kids are being exposed to screens and technology at earlier and earlier ages, and often being asked to read at earlier and earlier ages before they're visually ready. And so when we haven't developed the foundation in place to meet the demands, that's when we experience symptoms. So in a child, clear signs of functional vision problems that are because we're engaging with too many screens or asking our brain to read or do things it's not visually ready for would be reluctance to reading and skipping words, skipping lines, words going into and out of place and becoming blurry or double, trouble copying off the board in the classroom, squirmy with desk work. I mean, there's so many just like neon lights around these symptoms showing these symptoms have emerged because the individual hasn't developed the foundation in place to thrive in this digital world or in this sustained near visual concentration world that they're in. And so, I think you're absolutely right. I mean, and when we know better, we can do better. And from a vision perspective, this is just such low hanging fruit that nobody's talking about because from a medical standpoint, none of this is taught in school, and vision development and rehabilitation and the fact that we talked about eyesight and vision being different. Vision's represented in every lobe of our brain. And there's more areas of our brain dedicated to processing vision than all of the other senses combined. So many things can tip that scale and allow for vision problems that are preventable, but then they're also treatable if they're caught early enough and if we're doing the right work for the right reasons.
Totally. And I know that we're going to get into vision therapy, and I'm curious too if we'll be able to talk about like practical things we can do on a day-to-day basis, maybe not necessarily at an office. Because I mean, Gosh, it's just like hitting my heart now too. I mean, I have an 18-month-old, and granted, we don't really do TV time, and I don't let her watch videos on my phone, but the amount of FaceTime we do, and I know that can be contributing to things. And so this might kind of put a little bit of fire under me to be like, okay, we need to pull that back, but we'll get into that. But one thing that you did mention, you're talking about being fidgety in the desk. And as I was kind of preparing for this conversation, one thing that fascinated me was understanding the connection between ADD, ADHD, and vision. And it's fascinating because we think of them as entirely separate issues, but vision problems can sometimes mimic or even contribute to symptoms typically associated with ADD and ADHD. So can you explain how vision issues might be mistaken for or even contribute to these issues?
All right, let me roll up my sleeves for this. So ADD and ADHD are incomplete diagnoses unless functional vision problems that cause the exact same symptoms and behaviors are ruled out first. It's not like there's a blood test that you can take that says, oh, yes, you have ADD or you have ADHD. And the diagnoses are based off of symptoms and behaviors. And when you look up in the DSM-4, the classification for these diagnoses, more than 2/3 of the symptoms are the exact same symptoms that are associated with treatable functional vision problems. And I would say, truthfully, the only way to know how much of somebody's inattention is related to their eyes not working well together or their eye-brain integration not being where it could or should be is, well, this is all treatable. We treat it and we see where we are. I have countless patients who come in on multiple medications or even just one medication, and we go through treatment. Visual attention improves, cognitive attention improves, and then they no longer even need the medication. And our ability for our mind to stay focused is deeply ingrained in our ability for our eyes to stay focused. And so often the child who has great attention when you're reading them a story, but then when they're reading themselves or trying to look at a desk, I mean, they've got ants in their pants. There's reasons for that. And so often it has to do with literally our focusing system, but this is our ocular focus, our ability for our eyes to hold clarity and make something clear. And in my opinion, that is the number one functional system that is impacted most from screen engagement, especially at too early of an age, is these inside muscles of the eyes responsible for clarity either not being developed or not being able to sustain the demands associated with screens. So if everyone listening here were to make a fist with both of their hands and squeeze really hard, after a few seconds, your hands start to hurt, right? But if you were to let go and come back and let go and come back, you could do this all day long. Our focusing muscle is a sphincter circular muscle behind our pupil. So when we look close, the pupil gets small because the muscle is constricted. When we look far, the pupil is relaxed and we're looking and disengaging that system. When we're on screens, we're literally having these muscles locked in for countless hours without taking breaks. And I mean, number one thing we should all be doing on screens is taking breaks at least every 20 minutes for at least 20 seconds and looking at least 20 feet away, but way more often than that. But it's crazy when you actually look at some of the data. The average American spends 7 hours and 4 minutes a day on screens. That's average. Mm-hmm. The average 8 to 10-year-old in America spends 6 hours a day on screens. Niki, when you and I were kids, screens didn't exist, right? Mm-hmm. And now we have kids you'll see at the airport where, you know, they have mom or dad's phone glued to their face as they're walking down, or not walking, as they're in a stroller going down the hall. Or
I was at an amusement park and they had a child. I mean, I could maybe see petition for an airport because it's like boring and they're, you know, got to keep them calm. At an amusement park with the screen in front of their face too.
Like, and we wonder why certain generations now can't even maintain eye contact talking to people and are showing up for interviews via text or on a screen because they don't know how to look at somebody in the eye or talk with them in real life. And we're creating vision problems. I mean, not maintaining eye contact. If we can't do that, that's a vision problem. Any change in eye movement is a change in attention. If we can't control our eye movements, we can't control our attention. And so often the people who, even when we're talking about eye contact, when they're looking at somebody, they're thinking, do I look at their left eye or their right eye or their nose, or do I look at where am I looking? They're stuck on focal processing instead of peripheral and ambient processing. And so many of these kind of challenges, when you start to think about vision differently, you realize vision influences everything. Motion sickness, using reading as a sleeping pill at night, trouble catching a ball, not walking down a hallway and feeling overwhelmed in a grocery store or a mall because there's too much sensory input that's flooding in and we can't process, or a child who's overly attentive in the periphery, but they can't lock in front of them. These are all problems that have a visual component that's treatable.
Some of these things that you brought up, I'm like, okay, in the back of my mind, well, that sounds like a brain or neurological issue. I think of like the inability to look at somebody. I think, okay, what if you're on like the autistic spectrum or something like that? But what you mentioned earlier, and correct me if I'm wrong, that your vision or some of the input or integrations is involved or is housed in every lobe of the brain. So they go hand in hand. It's not like a separate thing.
You're hitting the nail on the head. These are neurological problems. They are brain problems. Yeah. And that means they are vision problems. Our eyes emerge from our brain during development in the womb. They're actually part of our brain. And they're the only part of your brain you can see without things getting really messy. But I mean, it's unbelievable when you think about how much is within our control that we don't even know has any aspect of control.
Yeah. Yeah. And I think having this conversation, I mean, already like my mind is blown. Why didn't I put the two of these together? But it makes sense the more we talk about it. Now, in regards to like the way for children's development, what should parents know about their children's vision development, and how can they ensure that their kids are getting the right eye care early on?
So, first of all, when we were all kids, we would go outside all day long, right? And we would play in the woods, we'd climb in the trees, we'd ride bikes, we'd play ball. And it wasn't until it was dark out or dinner time that our parents yelled at us to come inside. And now instead of dragging our kids inside, we're literally dragging our kids outside, away from screens, away from technology, away from everything that comes with that. And it's creating this world of just digital dependence. I am not anti-screens. I am not anti-technology. I'm actually very pro-technology. And I would say my practice is on the leading edge of technology. And we utilize augmented reality, virtual reality, eye tracking software in our vision therapy treatment. But in terms of what as parents we should know and what we should be looking for, I mean, first of all, screens should be eliminated. It should only be involved in life if there is a significant importance. So I know you have an 18-month-old, your 18-month-old does not have the visual foundation to be looking at screens. Mm-hmm. So I think the times when it's appropriate would be FaceTiming with a loved one. But there's a very big difference between, having the 18-month-old take the phone and put it against their nose talking to Grammy versus like, all right, let's mirror it on the television far away in the distance, where the bigger the screen, the farther away, the better. It's a completely different visual demand than it is holding it up close for that 18-month-old. And also Grammy and Grampy get to be a lot bigger and easier to engage with when they're on a faraway screen. So there's little tweaks or little substitutes that we can do that make a lot of what's commonplace less terrible, let's say. But, anything we should be doing, we should try and, especially at an early age when vision is still developing, we should be using all of our sensory systems for learning. So holding a book and holding paper allows for tactile feedback to know where this is, to aim in three-dimensional space, our eyes together as a team, versus on a 2D device with the glare, the brightness, the contrast. There's different eye movements required on screens than there are on a book or in real life. And, if you're seeing your child blinking a bunch with desk work, or leaning down, or moving their body, or covering up an eye, or squinting, or straining, or avoiding near tasks, I mean, these are clear alarm bells that we need to get this checked out. And so, I think the American Academy of Pediatrics has norms or guidelines out for how often somebody should be on a screen. And I would just always say everything in moderation. If you tell your child you can't do this, it's going to make them want to do this even more. So, all three of my kids, we have limits where they're not allowed to be on the screen for more than 10 minutes at a time. Mm-hmm. And my oldest are twins who are 10, and they get 2 10-minute intervals a day max. But if they're on screens, they are wearing their digital performance lenses without question. Mm-hmm. And digital performance lenses are specialized glasses that are therapeutic in nature, not compensatory. So they don't do the work for them, but they give their brain a better opportunity for their eyes to work together by decreasing the visual stress associated with screen engagement. So it's a very weak, low-powered magnification that is dialed in with a specific level with a really high-quality filter that blocks the high-energy, short wavelength light and some of the blue light. But it's protective in nature in that it makes screen engagement less terrible. And so I'm a firm believer every child or every person under 18 should be in the right pair of digital performance lenses so that their visual brain can be supported as much as possible when they're on screens.
And are those, so digital performance, I'm taking notes, are those something that we can just order online, or is that something you have to go through, an optometrist to get?
I mean, I'd say it's always ideal to go to an eye doctor and get everything checked out and make sure, the systems are functioning the way they need to be. But most eye doctors don't even know what digital performance lenses are. And this is something that's really common in the neuro-optometry space or the developmental optometry space. On our website, we actually have a digital performance lens shop where we have 17 different colors and 130 something different options for kids, where it's literally like getting a really low powered over the counter reader with a really high quality blue light filter that's got an anti-glare coating and, a bunch of other add-ons, but it's such low hanging fruit. And we have data and studies to show how protective these are for visual development and for not allowing the problems that will emerge from too much screen time to happen at the same rate of progression that they would otherwise.
So I know you just kind of laid out a handful of things, and I always like to question enough that I can understand the material and then re-communicate it to somebody else. And I feel like I want to get a better grasp on this. So like, for instance, in my bedside table, which I hardly use them, are blue light blocking glasses. This sounds extremely different from that. So I really want to distinguish, maybe simplified terms. Talk to me like you're, a 10-year-old of what these glasses do.
So, and let's definitely talk about blue light, because blue light's getting all the attention these days. And I've been joking and saying it's kind of like the new gluten, and blue light and gluten are like dancing together at the prom. So, all right, first of all, blue light is not bad for us. Blue light is actually essential for us, and it's essential for life, for regulating mood and alertness and circadian rhythms. But we want natural blue light from the sun first thing in the morning, in the evening before bed, because we have these specialized photoreceptors or cells in the back of our eyes whose sole job is to send the signal to the brain to secrete melatonin, or the hormone that regulates sleep, based off of responding to light. So if these cells are stimulated all day long by artificial blue light from screens, that leads to the suppression or melatonin not being secreted. And then we get this negative feedback loop, and that's why our internal clock gets all thrown off. So blue light's getting all this attention because of the pandemic and so much fear and other things associated. And there's also a lot of medical professionals saying there is no research to support that blue light protection eliminates eye strain, let's say. We're not talking about eye strain here. We're talking about the brain's processing of visual information and light, and how that can impact migraines and headaches and just hormonal regulation. So these digital performance lenses we're talking about have a component in them that block blue light at a high percentage, but that's not the main reason for them. This is kind of like cleats if you're playing soccer. You can play soccer without cleats on, but when you play with cleats, you're going to cut faster, you're going to kick the ball farther, it's going to improve your performance. These are cleats for your eyes for reading and for screen engagement. So what they do is there's a small amount of magnification. So kind of like if you were getting over the counter readers, but such a small amount that it doesn't do the work for the eyes and for the focusing system. It just changes how the brain responds to visual stress. And stress from the environment is this tendency where we're over focusing our eyes or not converging our eyes appropriately, the different skills needed for screen engagement that are locked in for longer and longer periods of time when we're on screens.
Kind of like that tension that you were talking about with the kiss. So
these glasses make it so it's like this. Yep.
We can relax.
Exactly that. And so they give the brain a better opportunity for the inside and outside muscles of the eyes to work together. They don't do the work for you. They're not compensatory in that, like normal glasses, you put them on, that becomes your new normal. You then adapt to that. You then need something stronger. These basically make it so that the tendency to over focus or focus the eyes at different planes, the root cause of that, the stress from the environment, is less likely to cause an adaptation or less likely to cause a problem.
So devil's advocate, maybe if we, past generations where we're not on screen time so much, I feel like, and I'm just trying to understand, a lot of times we want to flex the muscles, whatever that muscle is, we want to work. But now we are flexing way, way too much. And so we need to integrate more of this relaxation. And that's what these glasses are, just one component of what they're doing. Because right away I'd be like, well, it's doing the work, so it's not allowing our body to do it. But you're saying we've gotten to such a place now that we are so hyperflexed or tense that we need to allow more room for breaks or for that sphincter to relax.
So the whole use it or lose it mentality, absolutely for our visual system, we want to maintain flexibility. We want to use our eye muscles. We want to work out our visual brain like we work out our bodies. But what this is doing for up close is it's making it so that how we respond to stress is different. So from a visual perspective, when there is stress, when the autonomic nervous system goes into the fight or flight response, the pupils widen and we get this tunnel vision effect. That's for every human. When we get this tunnel vision effect, we're stuck locked in with this kind of focal processing like we're looking through paper towel holders. When we are on screens, that's presenting visual stress. So we're becoming more locked in like this, and we're making it so that screens are causing myopia, like we talked about initially, distance blur that's emerging because it's putting extra tension on the focusing system that the focusing system is not intended to be able to support. Our visual system is intended to track in the distance for the saber-tooth tiger that's coming at us, and to prepare ourselves and to know whether do we run or do we protect. We're now making those same careful eye movements that were supposed to be in the distance on this machine up close with all this brightness and light and contrast that is within arm's length when it's supposed to be far away. Mm-hmm. And so literally people who avoid screens and spend more time outside and don't do prolonged near work in the dark have a dramatically less likely chance of developing nearsightedness or allowing their nearsightedness to progress. And we now have data and research to support this. Science says 90 minutes a day outside is protective for the development of nearsightedness and the progression of it. And that prolonged excessive screen time and sustained near work in the dark are the three biggest risk factors for myopia to increase. And myopia is related to two things, genetics and lifestyle. That's the lifestyle portion. The genetics portion, we can't really control who parents are. But if two individuals were to have a baby today and both individuals were nearsighted, the child would have a 1 in 2% chance. If one of the parents was nearsighted, the child would have a 1 in 3% chance. And if neither parent is, a 1 in 4% chance. And that's because of this lifestyle that we're all living now. Mm-hmm. When we landed on the moon in 1969, a fourth of America was nearsighted. Right now, it's about 43%, and it's estimated that by 2050, that 50% of the world will be nearsighted. That's crazy. And we see the uptick post 2020 when screens were catapulted into every aspect of life.
Oh, absolutely. And with, the pandemic, the amount of people working from home now and with screens. And I mean, I have 2 huge screens right here. I know colleagues who have like 3 or 4 screens. So it's just constantly, and that's just your work alone, let alone on your phone. It was interesting. You mentioned, science has 90 minutes outdoors. That kind of reminded me of functional labs versus like traditional Western labs, where sometimes these normal ranges are really like they're not optimal ranges. So I imagine 90 minutes is the normal, but what's the optimal? The optimal is probably significantly more. And I just think about like, and maybe I ask you this, I think something that's happening now in this, like, what's the word? The moms that are staying home and kind of raising the family, making the sourdough, putting their kids in farm school and all. And hey, I'm all for that. I'm moving to Idaho. We might be doing something like that.
Love those moms.
Oh, totally. But I think about, these farm schools or nature schools, how much the abundance that are outside and versus these traditional schools. Now, granted, there are some like higher level private schools that every kid gets an iPad. That's I wouldn't say an anomaly because I think it's more common, but what about the schools that they're inside more? Even if there's not the screens involved, is there a significant difference of still the tactile, there's still books, paper, being inside a classroom versus outside? Does that make sense?
Yeah, 100%. So we know how massively important light is from just a development standpoint, but also engaging with three-dimensional space. I mean, a lot of schools now are showing kids pictures of clouds rather than letting them actually go outside and like explore the clouds and develop the visual cognition and the visual processing that we never even thought about decades ago. And now it's all just being spoon-fed to people. So the schools that really rely on multisensory learning, like Montessori schools and Waldorf schools and home schools where, you can teach to the strengths of the child rather than fitting everybody in the same box. When you're stuck indoors and you can't get movement out as an outlet, especially for young boys at earlier ages, I mean, it's leading to this entire culture of, overly diagnosed medical problems and then pumped with medication when in fact we're doing it to the kids. Right. And, not even to talk about diet and lack of nutrients in food and the need for supplementation. I mean, there's a reason why autism and ADHD diagnoses are increasing by the day. Right. And there's a reason why, functional medicine is now becoming the new sexy branch of medicine because we're addressing systemically the foundation that allows for healing and allows our body to heal itself with it, which it knows how to do, but only when it's given the right instructions. And when you're giving it terrible instructions in the form of food and environment and lifestyle and lack of just life-sustaining nutrients, that's when all these diagnoses emerge.
Absolutely. And I think traditional approaches are, okay, you have an issue with your foot. Let's just look at the foot. Whereas the functional approach is now, okay, every organ system, every part of the body works together. It's integrated. Just like you're saying with vision health, it's so much more is affected and we got to get to the root of what's going on. And I think hopefully that's where this shift is happening. And like you said, functional medicine is becoming more popularized and people are finding, I mean, I've been in the hospital since I was 3 years old. And it really wasn't until I started working with a naturopath where things started to shift, where I got, and I'm not like a stronghold on diagnosis, but it does give you an understanding of what's going on. It gives you information and how do we utilize that. I didn't get some of these new diagnoses until I started working with a naturopathic doctor. And then we were starting able to add on these different therapies and these holistic modalities, So we've talked a bit about this vision therapy, and I'd love to kind of dive into what does that look like? I'm sure these digital performance lenses are part of that, but what else does, what does this look like, the vision therapy, and how does it help improve someone's vision?
So vision therapy is kind of like physical therapy for the eyes, but really it's for the brain through the eyes. Because we don't see with our eyes, we see through our eyes. And really what it is it's like any good therapy. It's raising to the person's awareness what they're doing so they can learn how to self-correct, self-monitor, but specifically in this case, teaching somebody what it feels like, what it looks like, and the depth that ensues when they are, let's say, using their eyes together as a team versus when they're not. And then allowing the eyes to rewire the software of the brain to create new neuronal connections that fire together and then wire together so that problems like eye turns, they can be treated with vision therapy.
What's an eye turn?
So somebody has an eye that's turned in or out or up or down, let's say. The medical model would say, oh, well, we need to shorten or lengthen one of the eye muscles because for some reason you were born with one muscle that was too short or too long. That happens, but it's like less than 5% of eye turns, right? The vast majority are faulty visual development. We haven't learned how to use our eyes together as a team. So a child who skips over crawling or who walks too soon when they're developing the crucial bilateral integration and core foundation, that's the foundation from which we develop vision from. So kids who skip over crawling or walk too soon have a much higher percent chance of developing an eye turn or a lazy eye. A lazy eye, somebody who can't see well with one eye. The old school treatment that is still, I cannot believe this, being prescribed by the vast majority of doctors today is patching. And it's taking the mindset of, oh, you have a good eye and you have a bad eye. So put a pirate patch on the good eye so the bad eye has to work. Not only does that cause terrible emotional responses in kids, and no kid wants to walk around and be made fun of by wearing a patch and seeing the world so differently with the eye that they can't even see with. But we now have science and research to support what my specialty has known for decades, in that a lazy eye is actually a two-eye problem showing up on one side. And it's, unless it's addressed on a two-eye basis, unless it's set up so that we can arrange the conditions to teach somebody how to pick that eye in the presence of the other eye, to learn how to not let the good eye be as bossy and the other eye just kind of hang out in a virtual reality setup, in an augmented reality setup, or even with glasses or filters that says, okay, this eye is seeing a clown and this eye is seeing a hat, and we're manipulating the pictures or moving them different places. And then as soon as it seems like the clown from this eye disappears, stop. We teach you how to turn it back on and get the light switch to be back on. And then we keep it on as we're adding movement and balance and cognition and vestibular input so that we can literally rewire the brain to change how they're using vision. So vision therapy helps with those, but I would say some of the areas where it helps even more profoundly would be from a concussion or brain injury, let's say, where, you know, we talked about vision being represented in every lobe of our brain, not eyesight, but vision. And 2/3 of the neurons entering our brain actually originate from our eyes. So you can't have a head injury and not have vision be involved. It's just a matter of at what level. And so often when that happens, suddenly previously normal activities of life, like going to the mall or grocery store or navigating the halls of the classroom, cause this sensory overload where you can't filter and process all this information and you feel like you need to retreat. Or reading and engaging with screens can cause dizziness and nausea and even blurred vision. With vision therapy, we can literally establish order from all this disorder and help somebody return to learn and return to work or return to life after all these bad habits or maladaptations have been put into place. Or a child who's got a visual developmental delay impacting the ability to read and learn because they haven't developed the ability to use their eyes together. Or for an adult who, the old school, what most people think is in our 40s, all of a sudden you blow out the candles on your 43rd birthday and then your arms aren't long enough. You have to start holding things farther away to see them and you need reading glasses. It's kind of like what you said before about, well, when your foot hurts, you know, when your foot hurts, you don't just grab a wheelchair, right? You figure out why your foot hurts and you address that. So from a vision standpoint, we can literally enhance and optimize our visual system so that you can prolong the need for reading glasses and at least prolong the need for increasing the power in the reading glasses. But the quick fix is, let me just grab a higher power over-the-counter reader and do the work for me. Yeah. So vision therapy is literally teaching the eyes to work together as a team, the eyes, brain, and body to integrate and process information efficiently, but to really get vision to be the dominant sensory system that it's intended to be, to guide and lead and unlock so much of what's holding us back in life because we don't have the foundation or tools in place to be able to support the demands.
And it's wild to think of how much more involved vision is in your body just behind just regular seeing. I could very much see a role, and I'm curious if you have like an elevated amount of these clients of football players, jiu-jitsu or MMA fighters. I mean, the amount of concussions, my husband's, a fighter, and the amount of concussions that I know he's had in the past, I can see I mean, do you have a handful of clients that?
So this is fascinating. So about 60% of my practice right now is concussion and traumatic brain injury rehab. And we see a ton of athletes, but it's not the athletes that we're seeing at the high percentages. It's the mom who hits her head on the granite countertop, bending over to pick something up, or the dad who a kid throws a toy and hits him in the back of the head by mistake, or somebody who fell when they were a kid on the playground and had a head injury, or had a head injury or in a car accident and never thought anything of it. And then years later, they realize, wow, I get headaches when I'm on screens, or man, my eyes are really sensitive to light and I can't drive at night, or I feel like I'm not remembering what I'm reading and I'm having to reread all the time, or screw it, I'm just going to grab, audiobooks to do this. And then you kind of connect the dots and realize, oh, wow, you went from an avid reader to this reluctant reader almost overnight. Let's talk about what happened around that time, and then realize, yeah, there was a head injury and it never was treated properly. There's an interesting study that just came out that says a year after a head injury, up to a third of adolescents still have symptoms like irritability and headaches that clearly impact performance in school. And I am a strong believer that after a concussion, the problems don't go away. We just learn how to manage the symptoms more easily. But our brain learns how to use other areas to compensate because there's so much neuroplasticity. But that's even more of a reason why we need to tap into the neuroplasticity and rewire the brain at any age which is possible, so that we can use our brain the way in which it's wired and use these systems in synergy like they're supposed to.
Well, and this is why I see maybe why there's so much fire behind you of like getting this message out, because some of this stuff, the irritability, prior to this conversation, that wouldn't have been on my radar to think, okay, let me go to an optometrist to look into this. And I think the only vision health or screening I did my entire life was maybe third grade. I remember them coming, you had to do, look at the letters. I remember them doing an audio one. That was all that I ever had my entire life, or getting your driver's license. I can imagine obviously people with obvious visual, issues. What other, and you have mentioned a few, but I really kind of want to like create this space. What other symptoms that we might be experiencing should trigger, let me go to an optometrist, let me look at vision therapy would be helpful? I mean, I'm sure it would be beneficial for everybody in the whole world, but kind of these more standout symptoms of, why don't you pursue this?
When you bring up, the eye exams, all eye exams are looking at small letters in the distance. Nothing's looking up close. Very few are looking at the functional problems and the screening for these issues that occur at near. So vision goes well beyond just 20/20 eyesight. And so you really want to find a functional eye doctor. In the DC, Maryland area, for instance, I have a practice in Bethesda and Annapolis, Maryland. And let's say there's 6,000 or 7,000 eye doctors in all of DC and Maryland. There's only 7 of us who are board certified in vision therapy and rehabilitation. And 2 of the 7 are within my office. So there's so few people in this field. And so I think first step is go to get an eye exam. But when you're getting the eye exam, ask the doctor, what about my vision, not just my eyesight, and ask about the functional visual skills. Ask them to look at your convergence, which is literally taking a pen or pencil and say, tell me when you see 2 of these. It should be effortless to our nose. We're seeing 1 all the way in. NIH, a mile from my office, says that 20% of kids have a convergence insufficiency. I think the number is much higher, but that's still a high percentage, but that there is an incredibly high likelihood of having difficulty sustaining focus or being misdiagnosed with ADD or ADHD when there's a convergence insufficiency. We're all taught in school that's a screening test, but we're never taught what to do with that information or how to fix it. And it requires special training and residency and fellowship afterwards. So there's so few of us who do this, but really finding somebody who's board certified in vision therapy. So there's a great website, covd.org, which is the College of Optometrists and Vision Development. This is the international organization that board certifies doctors in this type of specialty. There's a whole section where you can click on it and it says locate a doctor. And then you can put in an address and put in a search radius of however many miles. and it'll tell you all the doctors within that search radius. And then there's even a box that you can click that says board certified in vision therapy. So if you see somebody board certified, you know you're going to get a really thorough evaluation. But I think the big problem with vision therapy is there's not consistency yet on what vision therapy looks like. So this isn't like physical therapy for a sprained MCL, where if it's a grade 1, you're getting a dozen sessions. If it's grade 2, you're getting 2 dozen. And no matter where you go, whatever physical therapy practice, you're going to get better and you're going to heal. You don't have to be board certified to offer vision therapy. And I would even go as far as to say there are plenty of people now who are not even doctors doing vision therapy. Coaches, teachers, OTs, PTs, speech therapists, because the need is so high. And so often that work is kind of the X-axis work. So across the body, that's the tracking system. But to me, life takes place on the Z-axis, which is the eye coordination system and the eye focusing system and the depth perception. But at least awareness is being raised by people looking into vision because the needs are so high. So if you go to somebody who's board certified and they offer vision therapy, again, there's not consistency on what that looks like. So always ask, who's doing the therapy? How often am I going to see the doctor? Any good program should put a big emphasis on home therapy on top of office, where ideally the new learning takes place in office. The reinforcement of that learning takes place at home. And just like any newly learned process, the more you practice, the faster you see things changing. But the proof is in the pudding. You should see things changing. And I tell every single one of my patients, if we're recommending vision therapy for you, this should change your life. And if it does not, it means one of us is not here for the right reasons. And we're not going to let that happen. So at least in my office, we have doctors doing the therapy. For us, it's the best way. So it's the only way to do it. But I think we're one of a handful of places in the country to offer it that way. That just allows for really good quality control. We also see some really complicated stuff. But to answer your question from an hour ago about what should we be looking for, I think the global stuff would be a child who is smart in everything but school, or a really smart child who's clearly got something holding them back, whether it's tears with homework, resistance to reading, wants to be read to rather than reading on their own, avoiding ball sports, poor balance or coordination. They're knocking things over. They're bumping into walls. Of course, the headaches, the eye strain, the double vision, the words moving. But more often than not, kids don't know that things aren't supposed to be that way. And parents don't know to ask these questions. And so it's like the first time this comes up is in the exam room when we're looking at their ability to converge their eyes. And we see that at a foot away, one eye drifts out, or they're saying, I see two. And then you say, hey, Billy, do you see two of things when you're reading sometimes? And it's like head bobbing and mom's either jaws dropped and she's crying, or she's saying, you never told me that. Well, how are they supposed to know that that's not how things are supposed to be? So I think the earliest signs, when you really know what to look for, they come out in preschool when we're learning letters and numbers and colors, and we're assigning labels and language to symbols. And if somebody needs constant repeated exposure to know that something that looks like this is an L, that's a sign of a visual processing problem, and likely a visual skill or an ability problem that's just not developed or starting to emerge. Or with sight words, if we're not able to take the string of letters and store them in our mind's eye to then be able to, with a little bit of practice, recognize what that sight word is. If the brain's like an Etch-a-Sketch and needs constant exposure, and yet it's not sinking in, that's a vision problem.
The amount of kids that probably, parents, start seeing this irritability, start seeing these other symptoms, not obvious vision things, and they bring them to the doctor to see if it is, if they're on the spectrum or something, like just some sort of mood regulation, or how many are actually going to an optometrist or looking deeper. Like I can't even imagine.
The eyes are the windows to the soul. And I know that's an overly said cliche line, but if you're looking at your kid's eyes or your partner's eyes or your own eyes, if you've got difficulty holding fixation on your eyes in the mirror, if your child can't maintain eye contact with you, if you're throwing a ball to them and they're turning their head away or it's hitting them, if they're in a car and they're getting car sick, and throwing up when you have the tablet in front of their face or when they have a book in front of their hands. First of all, get them to look out the window. But second of all, those are signs that vision is not developing at the rate it's supposed to. And it's not necessarily a massive problem that you're seeking. It's more, how do we reroute vision development so that things can be more linear and we're not taking these roundabout paths to get to where our visual system is supposed to go with normal human development.
Yeah, that makes sense. One thing I want to pull back to that you mentioned that I love so much, because I've done a podcast on critical thinking and really coming in, understanding and pulling information so that when we go to doctors' offices, we feel empowered and we feel confident to ask the right questions. And one thing you touched upon is even prior going to a functional optometrist, that would be great if you could start out there. You said, go just to get a regular eye exam. And these are the questions you should ask. And I know you one you said about convergence, but if you can kind of list, are there 3 main questions that we should be asking? And this is where the critical thinking happens. If they can't answer that, or they say, oh, there's not a difference between eyesight and vision, that should be a red flag that we need to go find someone else. We need to go somewhere else. So if you had to narrow it down, what are the most important questions we should be asking?
So for a child, number 1, is my kid visually ready for reading and learning? And that's as simple as, let's look at the 3 most important visual skills and abilities for reading and learning. And literally with the pen here, we could teach everybody listening how to screen for this, and happy to do that if you'd like, but it's convergence, it's tracking, and it's focusing. Should we go through the screening of that real fast?
Let's do it.
All right. So literally people listening will know more than most eye doctors do by the end of this of how to uncover a potential hidden functional vision problem. So you're going to want to do this to somebody rather than doing it to yourself, but we'll talk about doing it to yourself now. So the first, convergence, start with the pen at arm's length. Tell the person to look at the tip of that pen. There should be 1 pen. It should be single. It should be clear. And then you're going to slowly bring it towards their nose. And you're going to have them tell you as soon as it gets blurry or double, and then say stop. Should be effortless to our nose. The norms will say in the textbooks that 2 inches from the nose is considered normal. And then if it's back at another inch, 3 inches, you can regain fusion. That's considered okay. 6 months of age is when a baby can demonstrate convergence to the nose as they're taking food and toys and putting them in their mouth to learn more about them. When you start doing this, you'll realize a foot away, 2 feet away, it's hard to maintain a single image. By definition, that's a convergence insufficiency. And often it doesn't mean that there's an issue with eye muscle strength or length. It has to do with coordination of the eyes and a spatial mismatch, literally aligning the eyes as if you're perceiving that pen to be in a different place than where it is. And there's a really high correlation with convergence insufficiency and ADD or ADHD-like behavior. This literally can take 10 seconds to do. And I would imagine everybody listening now is like, wow, I've been in the eye doctor and they've never done that. Ask them to do that. And you'll be teaching the doctor something. So that's looking at convergence. Tracking system is taking that same pen and moving it across midline nice and slowly at about a foot to 16 inches away. Go side to side, go up and down. You can do a figure 8 pattern. It should be smooth and effortless where the eyes are kind of fluidly following the target. If you're seeing head movements and body movements, that's a red flag. By 7 years old, we should learn how to dissociate eye from head movements naturally. So if somebody's over 7, they should not be moving their whole head. They should be able to keep their head still and move just their eyes. But you'll see jumpy eye movements, overshooting, undershooting. You'll see loss of fixation. You'll see moving the pen and then they look. And by the time they look there, it's already in a new place. So they're jumpy all over the place. Somebody who's skipping words, skipping lines, losing their place, rereading, that is absolutely related to an oculomotor dysfunction. That's the tracking system. And then the focusing system is looking at the ability to make something clear and keep it clear. So most doctors know how to test that, but don't because it takes extra time. And I'm sorry, but if you're going to a 5-minute eye exam at the chain eye doctor's office down the street and you're buy 7 pairs of glasses and your exam is free and you get it for $5, like that's not the thorough evaluation you want. And at least once pay for a thorough evaluation or have insurance pay for a thorough evaluation because you'll at least get a baseline. But with the focusing system, an easy way to do that, that's a little bit more kind of grossly looking at this, is cover up one eye with your hand, take your finger where you can see kind of the fingerprint or the pads on your finger, and you're going to bring it as close to your eye as you can until it gets a little blurry, and then stop and try and make it clear. So you're figuring out the closest you can hold that clear. You'll notice that watching somebody, their pupils can get smaller and smaller as it's coming closer because you're constricting the muscle. And then you do it the same thing on the other side and seeing how close it can be. And you could do this with like a piece of paper that's got small font on it, but each eye you should be able to hold the finger at a distance that's the same distance from your face. So if one's here and the other's here, that means under two eye conditions, you're literally picking one eye rather than using both together because of this rivalry or competition. But in a doctor's office, they can actually measure how many clicks of lenses or how much weight can they lift with their focusing muscles. And there's norms for every age for what that should look like. So I think the acronym I give when I teach doctors or therapists how to screen for this is ACT now. So ACT is alignment, convergence, and tracking. If you remember those three, when you're measuring, it becomes a lot easier to look for these problems. The A, so the convergence and tracking we did, the A for alignment would be holding that pen still at about arm's length. And if you can think about a laser beam coming out of each eye representing line of sight, if the laser beams are pointing at the same place, if you cover one eye, the pen shouldn't move, the laser beam shouldn't move. And if you do see the same thing on the other side, pen shouldn't move, laser shouldn't move. If you see the eye move in because it was out, that's an eye turn. If you see it move out because it was in, eye turn, up because it was down, same thing. That's diagnostic for having a strabismus or an eye turn. So looking at alignment, convergence, and tracking is going to give you a clearer picture of where things are. But then also being a partner with your doctor, like ask them about achieving 20 happy rather than 20/20. And a lot of people can have both, but when there's a choice over comfort versus clarity, most people choose comfort. You should be able to have both. And if you're of the minds, if you are somebody who gets it has a shopping bag full of glasses and none of the glasses ever seem right, it's not that the glasses keep being broken. It's that something with the brain and the eye is not connecting, working well together is, I won't say broken, but not optimized. And so something like vision therapy very likely can fix that.
Yeah, that makes sense. That maybe the system behind it is malfunctioned or not working properly. Dr. Appelbaum, you've given us an abundance of resources and tangible things that we can ask for and apply. Just to kind of wrap things up, I mean, we'll talk about one more thing, but beyond, getting some of these glasses and going outside more, less screen time, are there any other components that we can start integrating and applying?
Yeah. So, I mean, I kind of relate this to like going to the gym. If you go to the gym and work with a trainer and you've got strength and cardio and weights and flexibility, and you're kind of doing a cross training approach, you're going to get into as good of a shape as you can in the shortest amount of time. The equivalent of that is going to the eye gym, going to somebody board certified in vision therapy. But not everybody has access to that. And there are a lot of people live in places around the world where there aren't people who have this type of specialty. So we actually have a really cool program called ScreenFit, which is really a revolutionary online vision training program designed to minimize the damage that screens have to vision and promote healthy visual habits and reduce symptoms so that we can all thrive in this digital world that we live in. So it's a simple kind of like body weight work rather than going to the gym. There's 2 different courses. Each course has 30 lessons. Each lesson should take 10 to 15 minutes to do. And none of them require equipment. A couple of them have charts you can print out, but they're intended to be able to do these when you're in the bathroom or at a stoplight or in between calls or patients or talking with friends, where it's keeping vision top of mind, but it's giving you exercises to do to maintain flexibility, stamina, strength, things like that. We've had as young as 5 and as old as 89 go through it successfully, with 100% of people who have gone through it seeing a reduction in symptoms. And we've had crazy numbers. Marriott's offering this to its employees. We're up for a couple government contracts. I mean, this is the type of thing that it's really low cost. It's really high value because it's a one size fits all approach for everybody. Now, if somebody has an eye turn or a lazy eye or massive head injury, this is not going to fix everything, but it's at least going to get you started on the journey. And this is something I created over the pandemic, because I saw what was unfolding before our eyes with my own kids. And now it's at least getting this out there to people, on a more widespread basis. But I think there's certain exercises we can all do, like push-ups for our eyes, where we're taking that same finger that we were using before, bringing it as close as we can, make it clear, hold it for 5 seconds, then look out in the distance for 5 seconds, back at your finger for 5 seconds, back in the distance. So kind of gross constriction, relaxation, back and forth. That's literally doing push-ups for your focusing system. It talks a lot more in detail of how to do that and how to fine tune that within ScreenFit, but there's lots of exercises like that where you have really nothing to lose to just start being more intentional with your eyes, but then also starting to listen to your body and recognize, like, wow, my energy is so much better on the weekends when I'm not on back-to-back Zoom calls all day long, and when I'm sleeping better. Well, yeah, there are reasons for that, but visual stress, a lot of us hold stress in our eyes, but then a lot of us are not moving and staring at near devices or near stuff all day long, when again, as humans, we're not intended or meant to be doing that. So I just hope this is educational and empowering for people to realize you're not stuck with where things are now. And even without knowing anything about you, there's a strong likelihood that you can improve and optimize your vision, even without taking massive steps. But ideally, go see an eye doctor who knows more about this stuff, or come to us. But either way, let's figure out how we can unlock so much of all of our potentials when vision can be holding us back in so many ways.
Absolutely. And that makes so much sense. I think this was incredible. It laid out so much information that I wasn't even on my radar. And I can imagine our listeners are learning and taking away so many components for this. Where can people find more information, not just about you virtually, but if they want to come into your clinic, do some of this vision therapy, where are you located?
So we are in Maryland, right outside Washington, D.C. Main office is in Bethesda. We have another office in Annapolis as well. Our practice is My Vision First. So you just go to myvisionfirst.com. A lot of our patients are local, but we also see a ton of patients for intensive vision therapy boot camps who come in from out of state or out of country and can accomplish a significant amount of work in a really short period of time. And it's a really dialed in system, with lots of different treatment lengths depending on what's going on and situations there. And then on social media and on Instagram is probably our most exciting platform. It's just Dr. Bryce Appelbaum, Dr. Bryce, and then Appelbaum. But my ancestors wanted to make things very difficult for us. So my last name is spelled E-L, not L-E, like an apple would be spelled. But I mean, a lot of stuff on there where, we're talking about the link between vision and learning, or we're talking about the link between vestibular migraines that in fact aren't really vestibular migraines. They're actually vision problems that are allowing for this hypersensitivity to manifest based off of the trigger that we can actually train our brain to respond to more easily. So really nice educational platform. And I've got an awesome team who helps me look good in terms of the dancing and the graphics, where that may not be a strength of mine.
But you bring all the content and the information, and I think the hope and I don't know, I feel more empowered to let me start, trying this stuff. So I think honestly, that's more important anyways.
I agree.
Than the looks of all of it. But gosh, I just so appreciate your time today and covering all this. I think this was foundational, incredible information. And I think we're going to have a lot of happy listeners. So thank you so much for being here.
My pleasure. It's such an honor to be on here and talk to your tribe, and love that you're recognizing the importance of vision, and appreciate the opportunity.